The Biden administration is rolling out a plan for just about everyone to get booster shots starting next month. And 9 Health expert Dr. Payal Kohli is joining us now. So I think many of us were caught off guard. Like, why is this happening now?
You're exactly right, Kim, because a month ago, we were saying that the science doesn't support booster shots. So what's changed now is that rate of breakthrough infections has suddenly skyrocketed. So that tells us one of two things. Either the efficacy of the vaccine is going down, or our opponent is getting stronger and smarter. And I think in this case, it's both.
Yeah, and we're hearing this and acknowledging this Delta variant in particular. This covers the Pfizer and Moderna shots. And so that's all we're hearing. And why is that? Is that the only information they have at all regarding booster shots?
That's right. So we have some limited data on AstraZeneca, which is a DNA vaccine, just like the Johnson & Johnson. But the majority of data that we have right now about boosters and how they behave in terms of boosting your response comes from the messenger RNA vaccines, the Pfizer and the Moderna vaccines.
Okay. So why do people wait 8 months? I mean, that's kind of a curious number, too. I mean, I know that they, when we got our first shot and then they preferred you waited X number of days, but now 8 months. Why are we hearing that?
Nothing magical about it. Number one, most Americans got their original vaccine about 8 months ago. So we're right about at that mark.
There you go.
Number two, we're seeing that after about 6 months is when those neutralizing antibodies start to go down. Now, whether this means that your ability to fight the infection also goes down, that's still a little bit of a question mark. But because those antibodies start to go down after about 6 months with Pfizer and Moderna, for example, we think maybe that's about the right sweet spot to boost it.
Okay. But for those that have compromised immune systems, they're saying go ahead and do it right now.
That's right. Do it at any point because those people need to catch up. So if you're immunocompetent, you've already got this nice robust response that maybe then starts to go down over 6 months or so. But if you're immunocompromised, you never really got to that top response because your immune system's been turned down. So you need that third shot to really catch up to everybody else.
Yeah, and there's so much to think about regarding this and like when you get it and the timing. But we're heading into the winter months, and I think there's some genuine concern about that as well.
I think there's absolutely genuine concern. There's concern about the fact, again, that the Delta is going up. There's concern about the fact, also on the other side of the coin, that we are lining up for round 2, where a lot of countries haven't even gotten round 1. And is this the right thing to start focusing on boosters right now and distract from getting everybody vaccinated?
And there are a fair number of people saying, don't do this, just get the ones that don't want to get it, get them.
There are a lot of health experts saying that because those are the ones driving the spread of the infection. And we know that even if our antibodies are going down, we're still keeping most people out of the hospital unless there's some special groups like the older people or immunocompromised. So does everybody really need a booster, or do we really need to focus? Right now, I would say honestly, personally, I'm not telling my friends and family to go line up yet because I'm not convinced that the safety data is there. When I see that, when the FDA has reviewed that, when there's an independent committee that says it's safe, not only does it work, but it's also safe, then I think I might put my arm out.
Okay, so we can get through September and October, maybe? I know we've had this date that was thrown out there, but let's
We will. We've gotten through much worse, Kim.
We can get with you next week and the week after and continue to discuss this.
That's right.
Thanks, Dr. Kohli.